Hi everyone, I'm ANANDA RAJ. The topic is attitude. Attitude is psychological, mental, nervous readiness. And attitude definitions you have to learn. And what are the characteristics of attitude? There are some basic important characteristics. Number one is attitudes are acquired. Number two is attitudes are formed. Number three, attitudes have got subject-object relationship, and attitudes are related to the emotions and feelings of the individual, and attitudes provide the direction to the human behavior, and attitude is a readiness to act accordingly. So these are the basic things of the attitude. And other important thing is the attitudes are related to the needs or the problems of the individual. So this attitude has got certain above characteristics. And what are the components of the attitude? There are three components. Number one is cognitive component. Number two is cognitive component. Number three is affective component. And next is the factors of attitude, or factors that determine our attitude. So these are the following factors which determine our attitude. There are three important factors. Number one is the environment. Number two is the experience. Number three is education. If we see the environment, the home, school, working place, all this comes under the environment. And experience, education also plays an important role for the development of different types of attitude in different types of people. And what are the factors that change the attitude? Here there are four important factors are there. Number one is the communication. Number two is the mutual contact. Number three is the individual influence. Number four is the group decision. So these are the factors which change the person's attitude. The next topic is the development of attitude. The attitude is acquired, it is developed, and there are different stages of development. Here the attitude development, there are four important factors which play there. Number one is the parents. Number two is the peers of the same age group people. Number three is balance. There is a balance theory. Number four is conditioning. There are two types of conditionings. One is the classical conditioning, other one is the operant conditioning. So the parents, peers, the balance, and the conditioning, operant and classical, these four are the one important for the development of attitude in each every person. And the attitude and the nurse, if you see the attitude and the nursing profession, nurse must understand the total psychology of the patient, because if she can understand the total behavior or the total psychology of the patient, she can understand the attitude of the patient. And nurse must also understand her own attitude so that she can help the patient. And some patients has unfavorable attitude, so nurse must understand that, and nurse must help to change that unfavorable attitude into a favorable attitude for the better treatment, or to facilitate the treatment and for the better or a faster recovery of the patient. So for this, the nurse has to do certain things. Number one is appropriate care. Number two is adequate examinations. Number three is work effectively. Number four, interest and concentrate on the work. Sufficient knowledge of the work which she has to do. and maintain the self-control and give the feelings of security and psychological support and sympathetic firmness, and develop self-confidence in the people or the patient, and maintaining peace and patience. So these are the basic characteristics which help to change the attitude of the patient. And next is the measurement of attitudes. These attitudes are measured by certain scales. Number one is the Thurston's scale. Number two is Remmer's Sitani Master Scale. Number three is Likert's method of summated rating scales. Number four is paid comparison method. Number five is rank order method. Number six is social distance scale. Number seven is public opinion polling. Number 8 is error choice technique. Number 9 is simple technique like anecdotal autobiographies and the diaries interview. So these are the important things of the attitude. Generally, question is asked the difference between attitude and aptitude. Aptitude is a special ability, and attitude is psychological, mental, nervous readiness. So this difference you must keep in your mind.